This is a recording of the educational session that was provided for postpartum physical health. If you don't know me, my name is Grace. I'm a third-year occupational therapy student at the University of South Dakota. I myself am a mom to a 1-year-old. Occupational therapy focuses on occupations. Occupations are things that occupy time in someone's day and are typically things that we want and need to do in a day. So for me, my favorite occupations are playing with my daughter, going on walks during sunset, and binging TV shows with my husband. These are the topics that are covered in this educational session. So the first thing that is discussed throughout this presentation is abdominal health. Your abdominal muscles provide you the stability that you need to move, twist, and breathe. And when you're pregnant, these muscles go through significant changes. As you can see in the image on the bottom right-hand side of the screen, there's a line of connective tissue that's called the linea alba. This holds your abdominal muscles together. Due to the presence of this line, there's always a small gap between your muscles. And during pregnancy, as your baby grows and your hormones soften your connective tissues, these muscles will stretch and pull apart, and that can create a much larger gap. This is called diastasis recti, or abdominal separation. After pregnancy, this can last from months to years, and for some women, it can be a lot harder to get rid of. This gap can cause problems in pelvic health, including urinary and bowel continence, back pain, and for a lot of women, it leaves a cosmetic pooch or shelf that remains at the bottom of their stomach, no matter how much weight that they lose. So I'm just going to go over a few exercises that you can do at home to try to help heal up that abdominal muscle wall after pregnancy. With any exercise that I give, it is important to note that you should consult your doctor first to ensure that you're healed and you're cleared to begin physical activity again. The first exercise is called a basic breath. So this can be performed standing, sitting, or lying on your back. You're going to breathe in deeply. As you exhale, you'll gently lift your pelvic floor and pull your stomach in, almost as if you're zipping up a snug pair of jeans. You're going to hold that position for about 5 seconds and then you're going to relax. You can do this for 5 to 10 breaths a few times every day. Once you're able to tighten and then relax without your back or your spine moving, that's when you can move on to exercise number 2. For exercise 2, this is called heel slides. So you lie on your back with your knees bent and your arms at your side. You're going to start with your basic breathing to engage your abs. You're going to slowly slide one heel away from you as you breathe in, and then as you slide it back, you're going to breathe out. A general rule of thumb with exercise is typically exhale on exertion. So when you're really forcing those muscles to work is when you want to breathe out. You'll switch legs and slide out and back in the other leg. One slide out and back is counted as 1 rep. So you want to try to aim to get to 20 slides on each leg comfortably before you move on to exercise 3. And this can take some time. This is not generally something that happens just in one day of trying these exercises. As you continue to heal up that core and strengthen those muscles, it'll be kind of a longer process. Number 3 are leg extensions. So you'll lie on your back with your knees bent, your arms at your side. You'll start with that basic breathing again. That's kind of the foundation to all of our exercises. You're going to breathe out and lift one leg so that your knee is up over your hip and your shin is parallel to the floor, kind of like a tabletop position. You're going to breathe in and slowly straighten that leg, lowering it as close to the floor as you can without arching your back. And then as you bring that knee back up to that tabletop position, you're going to want to breathe out. And then you'll switch legs. You can start with 5 reps per side and gradually build up to 20 reps per side before moving on to the next exercise. Exercise number 4 is called toe taps. So again, lying on your back with your knees bent and your arms at your side. You'll start with that basic breathing as our foundation. You'll breathe out and lift one leg at a time into the tabletop position. Keeping your knee bent, you'll slowly lower one foot to the floor as you breathe in, and then as you bring it back up to tabletop, you'll breathe out. So with this one, you want to start with both legs in the air, and as you lower one down to touch your toe to the floor, that other leg stays up. You'll then switch legs and do this again. You want to work up to 10 slow, controlled reps on each side. Once you can do that, you can move on to number 5. Again, lying on your back with your knees bent and your arms at your side. You start with that basic breathing. You're going to breathe out and lift one leg at a time into that same tabletop position. Once both legs are up, you'll squeeze your legs together and straighten them so they're pointing towards the ceiling. You'll breathe in and slowly lower both legs to the floor as far as you can without allowing your back to move. And then you'll breathe out and lift your legs all the way back up to the ceiling. Again, with this one, you want to work up to 20 controlled reps. With any of these exercises, if you feel any sort of pain or discomfort is common as you build up those muscles again, but any pain and it becomes unbearable to want to continue, stop doing them immediately and consult your doctor. And all of these exercises can be done 2 to 3 times a day as well. So the next topic that I want to talk about is pelvic health. I want to preface that I am not a specialized pelvic health therapist. I'm not specifically trained to work with the pelvic floor, but as a student, I have done great deal of research over this topic. So I'm going to provide just a little bit of information, but if you don't know where to start or you really feel like your pelvic floor could use some focus, I would recommend reaching out to a pelvic floor therapist. So the pelvic floor functions to help control urinary and bowel function. It plays a role in your sexual health and it helps stabilize your pelvis to allow you to move. When a woman goes through pregnancy, your pelvic floor can be impacted. That is because a woman's uterus is located just inside her pelvis and it sits right on top of that pelvic floor. So as your baby grows and gets much larger and through childbirth, it can put a lot of strain on the muscles of the pelvic floor and it can lead to issues such as incontinence, constipation, organ prolapse, pelvic pain, or pain during intercourse. If you experience any of these symptoms after having your baby, consult your doctor. You would want to go see a pelvic floor therapist who can provide assistance to help strengthen back up those muscles of your pelvic floor. I think it's also a common misconception that women who have C-sections don't experience pelvic floor dysfunction, and that is incorrect. Their baby still grows in that uterus that sits right on top of that pelvic floor, and so it is very much possible that a woman who had a C-section can experience pelvic floor dysfunction. I have another set of exercises that can be done to try to strengthen your pelvic floor. Like I said with the last set of exercises, consult your doctor before returning to physical activity and to ensure that you are all healed up. So this first one is the belly breathing again. This one is detailed just a little bit differently than our last one. So with this one, it recommends that you do this lying on your back with one hand on your chest and one hand on your stomach. You're going to take a deep breath through your nose and then breathe out through your mouth. As you do this, Your stomach should be, the hand that's on your stomach should be the one that's moving up and down, not the one on your chest. So you'll want to do this around 8 to 10 times. The second exercise is called pelvic tilt. So you want to continue to use your belly breathing during all the exercises that I'm going to give you. But you'll lay on your back with your knees bent and your feet flat on the floor. You're going to pull your belly button towards your spine and press your lower back into the floor. This should allow you to feel your pelvis rock forward. So like almost like your thighs feel like they're moving towards you in a way. You're going to hold that for 6 seconds and then relax, and you can repeat this 5 to 10 times. The next exercise, I think this one's pretty common, is the cat-cow exercise. So that cow motion, which is the one that you see where her back is arching down towards the floor, that one provides a very gentle stretch to your muscles, where the cat provides more of muscle strengthening. So that cat is the one where her back is arched up towards the ceiling. So with this one, you start on your hands and knees with your shoulders over your wrist and your hips over your knees. You're going to keep your back flat at the start and gaze at the floor. You'll round your back up towards the ceiling, letting your head relax down towards the floor, and hold that for 15 to 30 seconds. After that time interval, you'll then drop your belly towards the floor, lift your head up to look up a little ways, and hold that position for 15 to 30 seconds. You want to smoothly move between these positions 2 to 4 times. Our fourth exercise is bridging. So you're going to lay on your back with your knees bent at about 90 degrees and your feet flat on the floor. You'll bring your belly button towards your spine, and you want to make sure that you continue breathing. It can be really tricky with this one. You kind of want to hold your breath, but make sure that you're engaging in that belly breathing. You're going to push your feet into the floor, squeeze your bottom, and lift your hips up off the floor. You're going to hold this position for 6 seconds before you slowly move back down to the floor. It is important that while you're up in this position, your shoulders, hips, and knees should all be in a straight line. You can see in the picture on the bottom when she's up in this position, she's in a very nice straight line. If you were to have your feet too close to your bottom, that could impact this positioning. Or if you push your hips so high up that it throws you out of line, and you don't want to cause any additional pain to your back. Number 5 is a wall squat. So you'll position yourself with your back against the wall. You're going to walk your feet about a foot in front of you, and then you'll slowly move your bottom towards the ground as if you're going to sit in a chair. You'll hold this position for 6 seconds and then slowly rise. And you can do this 5 to 10 times. This is an exercise that covers a lot of different areas. It engages a lot of different muscles, including your core, your thigh muscles, and that pelvic floor. And the last one, I think, is a pretty common one for women to be aware of, but this one's called Kegels. So with this one, you squeeze your muscles as if you're trying not to pass gas or as if you're trying to stop the flow of urine. Your belly, your legs, and your bottom should not move. You're going to hold this position for 3 seconds and then relax for 5 to 10 seconds. You want to start with a 3-second squeeze, and then with each week that you practice this, add 1 second until you're able to squeeze for 10 seconds total. You can do this one about 10 times, 3 times a day. And with any of these exercises, you can do them 2 to 3 times a day. I want to preface with this one that it's very important that you do not perform this exercise while you are urinating. That can cause some extra pressure on the bladder and can actually damage your bladder. The next topic is sexual health. After going through childbirth, you may start to have questions or concerns for your sexual health, and every person has a different healing experience. So while it is recommended that women generally wait 6 weeks before engaging in sexual activity, it's actually not uncommon for women to want to wait longer. Many factors can inform the decision to return to sexual activity, which may include changes in your hormones, changes in your body image, increased stress levels, changes with your relationship. or just the birthing experience in general may have been really traumatizing, and so it's scary to get back to this. So I just want to talk about a few things that you can expect when you are thinking about returning to sexual activity after having a baby. Due to rapid hormone changes that women experience, especially during that 6 to 12 months postpartum, it's not uncommon for women to experience vaginal dryness. This is also increasingly common for women who are producing milk. So if you are struggling with this and you want to return to sexual activity, consult your doctor. It's generally recommended that you can utilize a water-based or silicone lubricant. If you are attempting to prevent pregnancy via the use of condoms, you want to avoid using oil-based lubricants because this can degrade the material of the condom and increase risk for pregnancy. It is also very common around that 6-week checkup for doctors to want to ask about what birth control methods that you would like to use. It's typically recommended that women wait 18 months before conceiving again. If you are breastfeeding, it is important that you talk to your doctor about what options are safe for you to use. With some birth control methods, it can cause a decrease in milk supply, so you want to do all your research before making that decision. It's also important if you're breastfeeding to know that breastfeeding in and of itself cannot 100% protect you from getting pregnant. It is also common for women to experience decreased libido or decreased desire to engage in sexual activity. Like I said, the many hormones that are surging through a woman's body may play a role in this. So there are ways that you can continue to be intimate with your partner during this time. But if this is something that is a concern to you, consult your doctor. And if you are not ready by the 6-week mark to return to sexual activity, that is okay. Definitely talk to your partner about your thoughts and feelings about returning to sexual activity. And if there's any concerns beyond that, consult your doctor. So this next slide goes over some adaptive equipment, and adaptive equipment are just things that you can use to make your daily activities a little bit easier. Postpartum recovery can be really hard on your body, so I'm just going to go over a few tools that I have listed on this slide here that can make participating in your daily tasks a little more manageable. The one on the top left is an angled peri bottle. So with this one, you can use this to perform your peri care or perineal care after toileting. You want to fill it with about slightly warm water before you go to sit down on the toilet. And it allows you to maintain your hygiene without needing to bend or twist as much. And I think this one can be really beneficial for women recovering from a C-section or women who have experienced vaginal tears. With women who experience a C-section, it can be really uncomfortable to have to bend and twist with that incision. So this helps prevent that. And with vaginal tears, that area can just be very sensitive. So wiping with toilet paper every time you go to the bathroom can be really painful as well. So this is a very neat tool. The picture in the middle, this is called a reacher. It allows people to pick things up from a lower surface or even a higher surface. I use it for that many times without having to bend or overexert their body. This can also be used to get dressed. So you can use it to put pants on over your feet without having to bend over as much. And so I think that can be helpful, again, like for women who have had C-sections, but really just any woman in general, and even for women who are pregnant. The one on the top right is a long-handled sponge. I think a lot of women have seen this one, but this allows you to reach down and in different areas without twisting or bending in different ways while you're showering. The bottom left is a sock aid. This one is utilized to put on socks without having to bend over. This can be especially helpful for, again, like women that have had C-sections or pregnant mothers. The one in the bottom middle is a shower chair. So shower chairs can be used to decrease the endurance that someone needs to shower by allowing frequent rest breaks as needed. It's also important to note that when you shower, showering in warm or hot water can fatigue your muscles a lot faster. So this can be a good option for women to use on kind of like a short-term basis while they rebuild that stamina and recover immediately postpartum. And then the bottom right is a raised toilet seat. This can be useful for women recovering from birth as movement and sitting can be uncomfortable. A lot of times going to sit on a toilet as well is much farther than you anticipate. So for women recovering from C-sections or vaginal tears, getting all the way down to that toilet might be uncomfortable for you. This can help reduce that. One more piece of equipment that is not pictured here on the slide, but I think is helpful is a squatty potty. A squatty potty allows you to position your knees above your hips, which then allows gravity to help assist you with bowel movements. And I think a lot of women can get intimidated by having a bowel movement after having a baby. So this can be helpful for really any woman who had a baby, but it is important that women with vaginal tears do not use a squatty potty unless it is okayed by their doctor. You don't want to rip open any of those stitches that you have. For items like the reacher and sock aid, I do not currently have a demonstration on how to use these items to get dressed, but if that is something that you are interested in, you can email me at grace.mcconnell, which is MCCONNELL, at coyotes.usd.edu. And I would be more than happy to record a demonstration on how to use these items and add them to the website for your viewing. Okay, something that I wanted to focus on is just with C-section delivery that I think gets breezed over more often than it should is scar management. So I think a lot of people think you just leave it be and it heals and that's it, but this is actually not typically the case, especially with a major abdominal surgery that a C-section is. So for scar massage and scar management, your first 6 to 8 weeks are primarily focused on protection of your incision. So you want to focus on following doctor-ordered movement restrictions. This can sometimes include weight limits to lifting and trying to reduce how much strain you're putting on your abdominal muscles. You also can gently use a cotton ball to rub around your incision to help with desensitization of the area. I want to emphasize that during this first 6 to 8 weeks until you are cleared by your doctor, it's that you're rubbing around the incision. You don't want to scrub on top of that incision until your doctor says that you are healed. After your doctor clears you, this is typically after about that 8-week mark, then you can start focusing more on mobility and sensitization. So following your doctor's approval, you can start to desensitize your scar by rubbing your finger or a piece of fabric, or a lot of therapists will use what's called Dicem. It's kind of like a rubbery material. And they rub it in circles on, above, and below your scar. This will help desensitize that area. And if you use something like Dicem, it can actually help break up some of that scar tissue as well. You can also gently pinch your scar between your thumb and your index finger and just very gently rub it back and forth between your fingers. This can break up some of that scar tissue and make that area just a little less tight. And then just a few tips that I wish someone told me when I had my C-section was when sitting for long periods of time, you actually want to focus on reclining backward more often than not. This allows your body to be in a stretched out position rather than your hips sitting at 90 degrees. With your hips sitting at 90 degrees, your scar can heal a little bit tight versus being stretched out is a much more optimal position. So I would definitely say that if you're sitting for long periods of time, try your best to lean back and stretch out. You can use a pillow to gently brace your abdomen when you need to laugh, sneeze, or cough. Abdominal binders are often used as well, especially for when women are trying to get up and move around. With abdominal binders, I would definitely ask your doctor on appropriate fitting, and sometimes PT and OTs can do this as well to fit that so that it's not putting any extra pressure on that C-section scar. And then high-waisted compression underwear kind of provides the same benefits as the pillow and the abdominal binder. All of these kind of hold in that area where the abdominal muscles should be doing those extra work, but having a C-section And just being pregnant in general, your abdominal muscles went through a lot, so they're probably not pulling their weight like they used to. And so these can help kind of give you a little extra stability through your core. The next topic that I just want to focus on briefly is ergonomics. So, ergonomics focus on the idea of looking at movement of the body as well as fit of the environment to that movement, with the goal of reducing strain and simplifying activities so that you're not overexerting your body. So, with this topic, I like to just preface that there's no one perfect posture. Everybody's body types are different, and sometimes people think, oh, well, I need to have a perfect posture, so they overexert themselves to get themselves into that perfect posture, and this can actually increase pain even more. So, just a general kind of rule of thumb with posture is if you were to have a stick behind your back, you'd want it to touch 3 points, so behind your head, in between your shoulders, and your tailbone. I'm going to go over just a few things that are common positioning when you're taking care of your baby postpartum, and just a few tips on how you can move your body to try to prevent strain and reduce pain. So with the first one, holding your baby. For young babies that lack head control, you want to try to carry them at your chest with one hand under their bottom and one supporting their head. If you're holding your baby out in front of you with one arm, try to alternate your arms as much as possible so that you're putting equal amounts of force through those arms and one isn't being overexerted. And then a position you generally kind of want to try to avoid is that propping onto one hip. I know I'm guilty of doing that pretty frequently, but it does put extra strain, especially I think because most women will prop onto the same hip. It does put extra strain on those muscles and ligaments in that pelvis. The next is baby wearing. So when baby wearing with your carrier, you generally want the buckle or where the straps cross, like in this picture, to be in between your shoulder blades. If there's a strap that goes around your hips, you can clip that around your hips, but make sure that the top is adjusted so that that's other clip is still between the shoulder blades. If you feel like your baby is sitting too low in their carrier, you can roll up a towel and put it underneath their bottom to try to boost them up. And this kind of helps you prevent that hip thrusting forward position of trying to off balance that weight. The next activity is feeding. So when feeding, you want to bring your baby to you rather than slouching over to your baby. This was another one that I was very guilty of. I was always slouching over my baby, feeding her, and I actually started forming like what's pictured on the top right is like a hump on the back of my neck, and it was causing a lot of neck pain. So you can do this by creating a nest of pillows. You can do like a couple pillows from your bed and then a boppy on top of it to bring your baby up high to you. And then just check in often with your body, assess if there's any pain or signs of stress. In terms of bed mobility, I think this is especially important for mothers who are recovering from a C-section. Any mom can do this though. Log rolling in and out of bed. So the picture on the bottom right is depicting a log roll. So you'll start with, when you're in bed, you'll start on your back with your knees up. You're going to turn over onto your side. And the big rule of thumb with a log roll is you want your shoulders, your hips, and your knees moving all the same direction at the same time. Once you're laying on your side, you're going to use your arm to push up off the bed as you pull your feet off the bed. And then when you're getting back in bed, it's just the opposite. So you'll bring your feet up as you lower yourself down. At that point, you'll be on your side to where you can then roll onto your back, keeping your hips, your shoulders, and your knees all aligned. This just helps reduce the stress that you're putting on your abdominal muscles. And especially for mothers with C-sections, just sitting straight up out of bed can really aggravate that C-section incision. And then just some environmental recommendations when changing your baby. Definitely try to change baby at a changing table that's hip height. This reduces how much you have to bend over. And try to keep all your materials that you need within arm's reach. That way you're not twisting, bending to reach those things. Using chairs with proper lumbar support. So if you're not sure what this looks like, you can definitely consult with a therapist, but just making sure that you have a chair that has a seat back that protects your entire back, and if needed, you can add a pillow down at that lower back to provide that extra support. And then using countertop bathtub. So while baby is still little, if it's doable for your family, using a countertop bathtub reduces how much you have to bend over to bathe your baby. But if this is not doable for you, bathe your baby however is best for your family. I just recommend that you, when you're bending over to bathe your baby, try to keep your back straight. And when lifting baby out of the tub, you want to keep that back straight and bend at the hips and the knees rather than lifting with your back. So, for breastfeeding mothers, nipple sensitivity is very common in that first week of breastfeeding. And there are some things you can do at home. As your body gets used to that stimulation, it should hopefully decrease. So, just a few things you can do at home is ensuring a proper latch. A lactation consultant can often help with this, but a therapist also can in some settings. So, I am going to go over just some breastfeeding mechanics in our feeding session, which is here in a few weeks. You can scan the QR code that was on that flyer, or if you found that flyer online, you can save the photo and hold down on the QR code. This will take you to our schedule, and you can see when feeding stuff will be covered, but I'll go over that a little bit more during the feeding section. You can apply breast milk to your nipples in between each feed. This can help hydrate and prevent cracking and bleeding of the nipples. And then the use of nipple shields or covers. So plastic shields can be used during feeding to reduce pain while your baby's latched. However, it is definitely recommended that you consult a lactation consultant before using these with your baby. There's a number of reasons for that, but a big one is with those nipple shields, it can decrease the amount of stimulation that your nipples are actually getting, and then your body is not being signaled to make more milk. So I don't want you to have a drop in supply. So definitely get in contact with a lactation consultant if this is something you're interested in. And then for nipple covers, those are typically called like silverettes. They're generally metal. They can be used in between each feed to reduce rubbing and friction that your clothes might cause. And you can apply your breast milk in the nipple covers and then put those on, and then it holds that breast milk in there to hydrate those nipples. If you experience significant pain during breastfeeding to the point where it feels like unbearable, or if it lasts beyond the first 15 to 30 seconds of a latch, consult your doctor. You may need a referral to a lactation consultant because baby's latch may not be appropriate. This is something that I don't think anyone really realizes can happen to you postpartum, and I didn't either until it happened to me. But this is called de Quervain's tenosynovitis. This is also known as mommy's thumb. This is caused by repetitive motions of your hand or wrist that increase inflammation and can cause pain on the thumb side of your wrist. And when you're caring for an infant, it seems like everything you do is repetitive wrist and hand motions. So this can actually be fairly common. If you experience this, you can do a few things to kind of try to remedy it at home. So one is icing it. If you're going to ice it, I recommend a protective layer between the ice and your skin, and try not to apply the ice for longer than 2 minutes at a time. You want to focus on ice with this condition rather than heat, because heat can increase inflammation in the area and make the pain worse. You also can wear a thumb spica, which is what's pictured on the slide here. When wearing a thumb spica splint, you want to make sure you're only wearing it during activities that are going to exacerbate that pain. So if you're lifting baby up out of the crib, or if you're holding your breast to breastfeed, whatever puts some extra strain on that thumb and that wrist, you do not want to wear this all the time. That can cause weakness in your muscles and make that pain worse. And then you start compensating using other muscles, and it can cause pain to radiate in other areas. And just a general rule of thumb is when you're lifting, holding, or caring for your baby, you want to try to keep your wrists in neutral, so avoiding a lot of bending. and then your thumbs abducted, which means essentially that your thumbs don't touch your index finger. If you kind of put your hand out in just a relaxed position, that's the natural position that your thumb will go to, is with your thumb abducted. With this, you also want to make sure you're not over abducting your thumb, which would be like splaying out your hand. If your pain continues or if it gets worse, consult your doctor. There are hand therapists that focus on this condition to try to reduce pain. So you may need a referral for that. With this topic, I want to keep it kind of brief because I know it can be kind of a lot postpartum. But ensuring proper nutrition is vital to not only taking care of yourself, but taking care of your baby. So I'm going to give some recommendations, but of course, you know yourself, your situation, and your family best. In terms of caloric intake, research actually shows that women who are breastfeeding need 500 more calories a day than when they were not. And that's nearly 2 times more than the 300 extra calories that is recommended during pregnancy. So you want to make sure you're eating good, nutritious meals when you're breastfeeding. With vitamins, it's typically recommended you continue to take your prenatal up to 6 weeks after having your baby. Then you can switch to a multivitamin with folic acid. And you want to continue taking any stool softeners, iron, or any other prescribed medications as your doctor instructs you to take them. For caffeine, for mothers who are breastfeeding, it's generally recommended that you limit your caffeine consumption to 300 milligrams a day. That's equivalent to about 2 to 3 cups of coffee. If this is kind of something that's intimidating for you postpartum and you don't really know where to start or you have goals that you want to meet, I would consult a registered dietitian or your physician for additional support. Okay, so in the implementation of this capstone project, I've had a lot of people ask me what occupational therapy can do for postpartum moms, and to be completely honest, it's hard to narrow it down. Occupational therapy casts a very wide net with our focus on occupations. And like I said earlier, occupations are meaningful activities that you do in a day, whether you want to do them or have to do them. This can include things like showering, dressing, eating, sleeping, walking your dogs, reading a book, a multitude of different things. And of course, in that is taking care of your baby. So occupational therapists can work with mothers and their infants to help make the transition into this new role a little bit easier while continuing to participate in their occupations themselves. Many of the occupations that a mom has before having a baby, those are just her occupations. But after having a baby, they become co-occupations, which are daily activities that take place between a mom and her baby. And this can be a little stressful because not only does mom have her own occupations to handle, but also babies now too. So just a few areas where OT can step in to assist new moms and their babies include developing routines for herself and her infant. This can be feeding routines, sleeping routines, just natural daily care times for baby, changing diapers. They can address physical dysfunction as a result of giving birth or caring for a baby. So that's kind of what we talked about with the abdominal health, pelvic health, some of those upper extremity conditions like the de Quervain's that we talked about. They can educate on child development. This includes ensuring parents are aware of what developmental milestones their child should be meeting, and that is with that includes a specialized approach. So if a child is born early, that may change, and they can suggest activities to help promote age-appropriate development. OTs can consult on lactation and feeding. They can modify the home to promote daily activity engagement. So like we talked about with the ergonomics, just ways to make doing your daily activities a little less stressful on your body. And they can provide support for maternal mental health. So if you are experiencing any difficulty completing your daily tasks or occupations, this includes taking care of yourself or your baby. Discuss the need for rehab therapy, such as occupational therapy, and in some cases, physical therapy is also needed with your doctor. And then here I just have a couple handouts. These will be accessible on the website, and I do have the link to the website here in a couple slides. So there's a maternal postpartum handout. There's a specific one for C-section. This here is the link to the website. If you're seeing this recording, you likely already navigated to the website. But if you scan this QR code, it should take you to a Google Doc with a list of Cheyenne local resources that can be beneficial as a postpartum parent. And then we're covering mental health as well, so feel free to navigate to that section to check out what we talked about there. And this QR code here just shows a list of the references that I used to build this content. Like I said previously, if you have any questions, this is part of a capstone project implementation that lasts 14 weeks. So you can email me at grace.mcconnell, MCCONNELL, at coyotes.usd.edu. If it is beyond the 14-week period of the capstone, there's a chance that I will not have access to the email to be able to answer you. So if you have any questions on this topic, consult your doctor and they can help guide you in the right direction. Thanks for watching.